Hi, my name is Dr. Richard Antbring. I'm a sport and exercise medicine consultant. I work in elite football, private practice, and the NHS in London. I'd like to talk to you today about runner's knee. Runner's knee is a very common knee condition, and it's also called patellofemoral pain syndrome. It's very common in many athletes and especially runners. And most people that run frequently has at some point experienced symptoms from attributed to runner's knee. Runner's knee is essentially referring to pain around the front of the knee as well as around the kneecap itself. It's not usually a specific injury, but it's a term that's used to describe a range of conditions that causes this type of pain. And the main symptom of runner's knee is usually a dull, aching pain. This can be experienced, for example, when running, but also when kneeling, squatting, or when standing up after sitting for long periods of time. There might also be a kind of a grinding or a popping/clicking sensation in the knee, especially when kind of going downstairs or upstairs. In order to diagnose runner's knee or patellofemoral pain syndrome, a thorough history as well as examination need to be done in order to exclude other conditions that can occur in the knee, as well as to guide further investigations as well as management. Ultrasound can be useful to be in the clinic to see whether there's any swelling of the knee, as well as to look at the general health of the tendons and ligaments of the knee. If there is any doubt in the diagnosis, then an MRI can be arranged to look at the internal ligaments of the knee as well. What's also important is to also look at the biomechanics of the runner or the individual in order to see whether there's anything in terms of the running stride or the way they do exercise that can contribute to pain around the knee, such as the way their kneecap is moving when they're squatting. When the pain occurs, it's important to think about maybe initially resting the knee in order for the initial inflammation to reduce. But then it's important to think about the next steps. I would arrange physiotherapy for anyone that has runner's knee symptoms, as it's crucial that we look at some of the biomechanics as well as improve gluteal and quadricep strength. Most of the evidence around runner's knee and patellofemoral pain syndrome is suggested that quadriceps and gluteal strength is crucial in order to reduce pain in the knee going forward. There is also some more temporary measures that can be employed, such as taping. For example, if there's an important race that is coming up, these are the things that we can look at in order for you to be able to do that race. Using help from colleagues such as podiatrists, we can look at your footwear as well as orthotics. And this can also be something that's very important in reducing knee pain. Once the pain has started to subside, it's essential that we return to activity in a gradual manner. This means slowly increasing intensity and not going back to exactly what we're doing once we stop running. It's important during this time period that we pay very close attention to how our knee is feeling symptomatically and whether there's any pain whilst we increase our running from week to week. In summary, runner's knee is a common but very manageable condition that causes pain around the kneecap. With proper care, most people will recover fully and can return to regular activities such as running. If the pain persists despite these measures, it's a good idea to follow up with a sport and exercise medicine consultant for further advice.